It was family laundry day. Much like with any chore, I was going about it without really thinking about the how or the why, just the same steps every day on autopilot. A quick sort, a quick check of the pockets. And, I had been burned by that forgotten crayon in the past. You know what I mean. So then everything went into the washer. It was on that last check of the pockets that I hit the laundry day jackpot. I had found a $20 bill. I don't know about you, but this is as likely as finding an ancient shilling in my house. I can never seem to find cash when I need it. So, all of a sudden, this mundane chore became the opportunity to daydream. What was I going to do? Go to the local coffee shop? A quick manicure, or maybe a ticket to the movies. I had found money. But then all of a sudden, it hit me. Where did this money come from? Was it mine? Was it my husband's? Was it my kids'? I could not remember which pocket this money came from. I thought about it and I thought, well, it came to me in the family system of laundry, so maybe it should just be mine. Or maybe there was some other intended use for this $20. Maybe I should ask or check. Maybe there was some other purpose for this $20 beyond me that would benefit others. Was it in the wrong pocket? This reminds me of a situation we call a wrong pocket conundrum. I think about this scenario on a larger scale every day as a family physician and population health expert. The question of who pays and who benefits is a scenario we think of on a larger scale every day across the spectrum of non-medical issues where health and social services often interact. And I'll tell you, a lot of people ask me this question of why does money flow through the healthcare system the way it does? Well, the answer of it's always happened that way no longer works for me, and it shouldn't work for you either. The reality is, if we can't figure out how to redirect those dollars to solve long-term problems, it is our nation and our children that will pay the price for this unwillingness to change. So, what is a wrong pocket scenario? A colleague of mine, Stuart Butler, describes this scenario as one in which one organization pays for an evidence-based solution, but another one benefits. I'll tell you that for all of you economists and bankers in the room, this is an incredibly hard sell. But unfortunately, it also leads to underinvestment in our social services system. It creates inefficiency and underinvestment. This reminds me of the story of Alice and Bob. Alice was responsible for health and social services in her community. She was desperately trying to help Bob figure out the range of non-medical problems that faced him. Bob was a well-known client and faced chronic homelessness, high blood pressure, and fragile diabetes. He also had mental health issues and would frequently be intoxicated due to his alcohol dependency. He would get a little disorderly and then forget to eat, and unfortunately was challenged with low blood sugar at that point in time. Now, he would end up either in the local jail or in the emergency department. But Alice desperately wanted to help him. And despite tough budget times, she found the resources to make sure she could pay for supportive housing that included a program manager and coordinated services to make sure that Bob was able to be safe, healthy, and housed. Now, the challenge with all of this is that when you started to look across the spectrum over a 2-year period, the reality is these type of programs have evidence that they work. After a 2-year time frame, Bob and others like him were more likely to be housed. They were less likely to be in shelters, emergency departments, or jails. This looks like success, right? But the reality is, Alice's investment was creating savings that landed in the law enforcement budget over here. And the savings were actually so great, it could have covered the entire cost of supportive housing. Alice's investment was creating a return on investment that landed in the sheriff's pocket, the wrong pocket. This story shows how the social determinants of health are often intertwined. It also shows that if we don't solve the problem of a wrong pockets conundrum, we are going to continue to face challenges solving the nation's health issues. This also reminds me when I served as Secretary of Health and Social Services in this great state of Delaware. I was working really closely with law enforcement to try to address violence prevention in our state. We were working and reaching out to a group of young men and women who were group or gang involved and telling them, put down your guns and stop your group involvement, or you will end up in prison. Not close by here in Delaware, but in federal penitentiary. This intervention is called a group violence intervention. It's led by David Kennedy nationally and has worked successfully across our country to decrease gun violence. We wanted to invest in it to make a difference in violence prevention in our community. Well, through this, I had the privilege of meeting a young man who wanted to get his life back on track. For the sake of our story today, I'll call this young man Dwayne. He took the courageous step of showing up to one of our violence prevention call-in meetings. This type of meeting brings together known, group-involved, gang-involved members, where they bring them in to show up alongside law enforcement, community leaders, politicians, educators, so that we can say to them, we are here to help. We love you and we don't want you to die. Dwayne raised his hand. He said, I want help. He told us his story. He said, I dropped out of high school due to learning disabilities. Family support was thin and money was tight. I found support where I could find it, on the streets. I need your help. And I will never forget his next words. He said, if I don't get your help, I will be the next to be targeted and be killed. Well, I wanted to help right then and there. And so we did. We got him housing an hour away. We fixed his car. We got him a job and counseling to address his childhood traumas. This, to me, was a no-brainer investment. It cost us $5,000 for this intervention. And the reality is, if you thought about the savings generated to the state and the citizens of Delaware, it likely saved court costs and time, years in prison, compounded by loss of productivity while incarcerated, potential healthcare costs due to other gun violence encounters, and the incalculable savings, the costs of lives saved. This story shows how incredibly difficult wrong pockets problems are. Both stories show how the range of characters are intertwined between systems, politics, and people. A wrong pocket scenario is one in which one sector, healthcare, for example, pays, but the benefits accrue to other sectors like education, social services, or even the criminal justice system. We need to figure out how to redirect those savings so that they are shared equitably. We can and must solve this. We must invest in our children. We know from the evidence-based work of James Heckman and the Perry Preschool Project that investing in early childhood has the potential for long-term, multi-generational impacts into adulthood. the time is now to move beyond business as usual. Investing in our children is the single most powerful lever to ensuring a healthier nation and a more robust economy. Determining how to reorient our paradigm to ensure we're supporting systems that are grounded in investing in our children is how we move beyond into a healthier nation. You may say, what would this system look like? Well, it could take many forms, but it could look like children's cabinets, pay for success funding, or even wellness funds. These are all solutions that exist that are based in investing principles and collective impact. We can figure out how to do this. One idea is to create a federal-level coordinating structure for children and youth. Along with 400 partners, Nemours has pushed for this structure to exist at the federal level. One idea would be to have a children's cabinet. A children's cabinet could ensure that at the federal level, we're coordinating around the needs of our children and making sure we're implementing new policies and making sure those investments proceed for the long term. This type of cabinet could coordinate with the Domestic Policy Council, the Office of Management and Budget, states, tribes, localities, philanthropy, the private sector, and even have the voices of children and families represented. This type of structure could address ongoing challenges that our nation is facing today, such as the youth mental health crisis, rebuilding our childcare sector, or even tackling the challenge of eliminating child poverty. Creating coordinated structure will allow us to focus on the unique needs of children and youth, and also have equity in mind from the beginning to tackle the nation's biggest challenges. I've seen such a structure work at the state level. In states like Delaware, where we have a Family Services Cabinet Council, this coordinating structure brought together leaders from the governor's office, state agencies, and community to address challenges. We took on issues that were difficult, like trauma awareness, violence prevention, and even enhanced economic supports. During the pandemic, this Family Services Cabinet Council tried to coordinate and respond to unmet community needs by assessing what families needed and then making it easy to find when they needed food supports, when they needed childcare access, when they needed computers and broadband to work in their communities, or even to make sure that they had temporary housing to stay safe. Elevating this to the federal level could ensure a more robust and accelerated response to COVID-19 and beyond. I will tell you, families across our nation are telling us they need more coordinated social supports to respond to their ongoing needs, not the piecemeal programs that exist today with little to real safety net. Rather, they need a redesigned system that centers on their needs, the needs of their children, their families, and has equity in mind. One idea would be to combine these social supports, make it easy to access, put food stamps or SNAP, earned income tax credit, child tax credit, housing, all into a one-stop shop that could be easily prescribed just as we do any other needs in healthcare. This is a critical step to ensuring we have the opportunity for all children and communities to thrive. So, what do we want? We want healthier communities. We want fewer mental health crises. We want more children to access high-quality preschool and graduate from high school. And where do we start? We start with children. Improving social needs will elevate all of our physical and mental health. Investing upstream before problems start will lead to a healthier nation. Investing in kids will lead to long-term population health. Investing upstream, focusing now, Nemours and all of us can create the healthiest generation of children. Until we solve for the problem of thriving kids and their families, it really doesn't all come out in the wash. The stains of inequity for want of high-quality health care and education, the opportunity for redemption, a more prosperous future remain. Our children suffer this reality the most. Their future is our future. Together we can and must do better. And so you see, just like when I found that $20 in my wash, some may have a different purpose. But when we raise each other up, there are no wrong pockets. Thank you.